Hello everybody, welcome to my YouTube channel, Homeopathy Super Sessions by Dr. Jagos. Today we'll see the part 2 of Alternation of Remedies, chapter by Carol Dunham. Well, in the last video about alternation of remedies, we had seen the example of a case of pleurisy in which bryonia was given. It had some effect, and later on, seeing the past history of the patient having a soric taint, sulfur was given as it covered up the most of the totality of the case. So that was an example of succession of remedies in which each remedy was given after taking the totality into consideration and after seeing the whole case as a whole. And we have treated as if that case was a new case, and we have again taken the symptomatology of the case. Now, in this chapter, in the part 2 chapter, let us see a different example of a case of acute tonsillitis. The physician collects all the symptoms and prescribes belladonna to be followed in 4 hours by mercuries and again in 4 hours by belladonna. So the physician takes the case and he finds that in this case, belladonna and mercuries, both of them cover up the totality very nicely as compared to a single drug which doesn't cover up the totality. So out here, in the case of acute tonsillitis, belladonna was given every 4 hours, and again it was alternated with mercuries. This is an example of alternation of remedies, and it is totally objectionable. So out here, this is a classical example of when we are doing alternation of remedies. And this is not applicable to homeopathy, hence it is totally objectionable. The second remedy prescribed must always take into consideration the actual condition as modified by the action of the first remedy. So whatever second remedy you are giving, you must also take into consideration, or rather always take into consideration, the actual condition. See what symptoms have been ameliorated, see what new symptoms have come up, see what symptoms are not ameliorated or they are in the condition of status quo. Then again retake the totality and then prescribe. Whereas in this case of acute tonsillitis, what are we doing? We are giving belladonna, then we are giving mercuries. So second time when we're giving the remedy mercuries, we are not taking into consideration the totality. We are not seeing what the actual condition of the patient is, but we are alternating belladonna and mercuries at the interval of 4 hours. So this is totally objectionable, not allowed in homeopathy. So whenever a second prescription or the second remedy has to be given, we have to see the actual residual condition of the patient after the first prescription has acted or the first remedy has acted. See what symptoms were better, see what symptoms were status quo or not better, see whether there are any return of original symptoms, or see whether any new symptoms, and accordingly take the full totality and then prescribe. Hence, in this case, it cannot be exact homeopathic prescription. So therefore, in a case of alternation, it cannot be called an exact homeopathic prescription. Hahnemann has expressed himself very clearly in the subject in Organon. So for that also, Hahnemann has also objected to polypharmacy, and he has said that it's not allowed. And in the cardinal principles of homeopathy, he had said that you have to give one single simple remedy in the unadulterated form. The aphorisms which deal with this are 272, 169, 167, and 168. So if you want, from this book, Carol Dunham, Alternation of Remedies #1 or the part 1, you can read pages 159 to 160, wherein more details or other examples have been also given. Thus, the name of Hahnemann, Bonninghausen, and Hering have been deceivably used in the support of alternation of remedies. So great personalities like our master, Dr. Hahnemann, Bonninghausen, and Hering, their names have been used deceivably by saying that these people also supported the alteration of remedies. The case which Dr. Cox refers to as cured by Hahnemann was by the alternate use of bryonia, tincture, and pulsatilla. So Dr. Cox also pushed his claim forward by saying that Dr. Hahnemann, our master, also used the alternation of remedies. He gives the example of the alternate use of Brownia tincture and pulsatilla. However, the author says that Dr. Cox should inform us about where this case was recorded in the homeopathic literature. So, however, the reference of it wasn't obtained, but Dr. Cox had claimed this about Dr. Hahnemann. Hahnemann in Materia Medica Purea, Volume 2, 3rd edition, 1838, relates two cases. One which was cured by a single dose of Brownia and the other by a single dose of pulsatilla. So, as you can see, there were two cases. Both the cases were different. One case was cured by Brownia, other case was cured by pulsatilla. So, Dr. Cox may have mistakenly blended the both together. It is often stated that Hahnemann used Brownia and Rustox alternately very successfully in treatment of typhus or hospital fever. Furthermore, also people were saying, or Dr. Cox and his accomplices were saying that Hahnemann used Brownia and Rustox alternately in the treatment of typhus or hospital fever. Now, let us see regarding this what we have to say. In Hahnemann's lesser writings, page 631, will show how erroneous this statement is. So, this statement of alteration of Brownia and Rustox in a case of typhoid fever or hospital fever was erroneously stated. Hahnemann says the fever has principal two stages. So Hahnemann was very clear. He said that the typhus or the hospital fever had definitely two clear stages. Each stage had this characteristic or distinguishing symptom. So each stage had its own PQRS or own characteristic symptoms or symptoms which were distinguishable in order that we could, so that we could initialize the case. The first stage is characterized by pains and consciousness, and the second stage by delirium and mania. So the two stages, you're getting two different sets of symptoms which are characteristic in nature. Thus, according to the symptom similarity, Brownia is indicated in the first stage, in which there is pains and consciousness, and in the second stage, Rustox was indicated where there is delirium and mania. Hahnemann proceeds to give special indications of each of these remedies and says that as long as improvement goes on, do not administer the other medicine. So you have given one medicine according to the symptom similarity, according to the stage present. You have taken the totality, and Dr. Hahnemann says that do not repeat the next remedy as long as improvement is going on. The next medicine will only be administered if the symptoms call for it. So the next medicine will only be given if the totality changes, or in other words, if the symptoms call for it. Thus, the whole disease is generally removed by a single dose of the first or the second medicine. So the whole disease is completely annihilated by a single dose either of the first medicine or the second medicine. If, however, the disease will pass into the second stage of delirium and mania, then Hyoscyamus niger would meet all the indications of the case. So, however, he also states that if the disease will go into the second stage, wherein the symptoms are of delirium and mania, then Dr. Hahnemann said Hyoscyamus niger would be also useful. The generic symptoms of the disease are always accompanied at the beginning by one or two groups of the characteristic symptoms. Accordingly, as one or two of these groups is present, Brownia or Rustox is given. So according to symptom similarity, whatever generic symptoms are present of that group, they are given. When the amelioration ceases, the case has to be examined anew, and according to the characteristics then found, a new remedy is to be selected, and thus the practitioner goes on in the same direction until the case is cured. So after giving the remedy, when the amelioration doesn't take place or it takes place and it has ceased, there's no further amelioration occurring, then you again have to examine the case as it was a fresh case or a new case and see what symptoms are there which are characteristic in nature, and see what new remedy could be found out with these characteristic symptoms. So in this manner, you go on treating the case until the case is completely cured. It should be always remembered that no alternation is allowed or advised. So Dr. Hahnemann again tells you that it should be always remembered that there is no alternation is allowed, but you are doing the succession of remedies based on the symptoms which have changed according to the previous medicine which was given, wherein the ambulation ceases, and again you retake the case and you assess the new totality and you give the remedy. Hahnemann gives another example where he uses aconite for the treatment of membranous group in the literature of the drug Spongia. Here nothing has been said concerning alternations. Thus, the physician, while treating cases, has in its powers to visit his cases frequently so that he can perceive the deviations for the true homeopathic prescribing. So Dr. Hahnemann says that when the physician is treating the case, he has to go to the patient's house and he has to have frequent visits to see what were the deviations in order that the next best remedy could be prescribed according to the true homeopathic sense. If it proves necessary, the physician will give succession of remedies. So if the symptoms have changed, if in his visit he has seen that the symptoms are changing, again retake the case as if it was a new case, find out what was the deviated totality which is characteristic in nature, and you have to prescribe a remedy. So therefore, Hahnemann always tells you that it is necessary that the physician will always give succession of remedies and not alternation of remedies. This will be done only after careful study of the case of both the symptom of the patient and the provings of the materia medica. So when you want to do succession of symptoms, you have to, or rather succession of remedies, you have to carefully study not only the case in its symptomatology, but also the indicated remedy through the materia medica, through the provings in the materia medica. Thus, the best corresponding remedy will be selected on each occasion of the case. So, on each occasion, when the previous remedy has not shown maximum effect, but it has shown some effect and the ambulation stops, the next best remedy is found out through that by retaking the case as if anew and finding out the remedy through the and confirming the confirming the symptoms to the materia medica. Hahnemann once again reminds us never to repeat the dose or give any other remedy as long as ambulation is taking place. So once again, Dr. Hahnemann reminds us that as long as ambulation is taking place, please do not repeat the remedy. Let the action of amelioration of that remedy unfold itself to the maximum. When only it stops, then you have to again retake the case. But as long as the case has been ameliorated, do not give any other medicine. You can just give a placebo, wait and watch. This is the best the physician can do while treating disease under the disadvantage of never seeing the patient. So if by chance you don't have the opportunity to see the patient, then this is the best thing the physician can do. Or you can tell the patient that as long as the patient is feeling better, do not give the second dose of the powder. Just wait and watch. It is well known that Bonninghausen never visits its cases, but chiefly prescribes from his office. So Dr. Bonninghausen, he just prescribes from his office and he hardly visits the cases. He knows that the first symptom of croup is uniformly combined with local inflammation, which along with all other symptoms from a group which aconite corresponds better than any other remedy. So therefore, in case of croup, where there's local inflammation and other symptoms, they correspond with aconite, according to Dr. Bonninghausen's experience. His instructions are very clear that the second powder is never to be given until the amelioration of the first shall have ceased, and so with the remaining powders. So Bonninghausen has given very clear instructions to the patient saying that as long as the amelioration has taken place with the first powder, do not give the remaining powders. Dr. Hering's view are similar to those of Dr. Bonninghausen. So even Dr. Hering endorsed the same view as that of Dr. Bonninghausen. The author says that he would prefer to wait and get the statement from Dr. Hering himself and his arguments about the concept in both theory and practice. So the author says that he would definitely like to wait and get the statement from Dr. Hering himself, and then only we can then furthermore argue if at all we want to argue. So that's all about in this part 2. Thank you very much for watching my channel. Hope you enjoyed. Have a great day.